Welcome back to Informed Sources. Just over 2 years after the World Health Organization declared the coronavirus a pandemic, the tide is apparently turning here in the United States. The nation's foremost infectious disease expert, Dr. Anthony Fauci, says we're currently out of the pandemic phase. Right now, we're averaging about 50,000 new coronavirus cases a day nationwide, which is the lowest since the summer of 2021. Here locally, the Shelby County Health Department is reporting about 50 cases daily. But in an interview with PBS NewsHour's Judy Woodruff, Dr. Fauci tells the U.S. is not going to eradicate the virus.
If we can keep that level very low and intermittently vaccinate people, and I don't know how often that would have to be, Judy, that might be every year, that might be longer, in order to keep that level low.
The CDC predicts COVID-19 hospitalizations will increase nationwide in the coming weeks following an uptick in cases. In the meantime, they're estimating the virus has already infected more than half the U.S. population and 75% of Americans under 18. We turn now to one of the Mid-South's leading experts on COVID-19, Dr. Stephen Threlkeld from Baptist Memorial Healthcare. Thank you for being with us today.
Hey, Stephanie, good to be with you.
Well, I'm going to jump right in there and ask you about those comments that Dr. Fauci made saying that we're out of the pandemic. But I want to add a point of clarification that he told the Washington Post, quote, the country is not out of the pandemic, but out of the full-blown explosive pandemic phase. Do you agree with that?
Yeah, I think since there is no precise definition for a pandemic, I figured that would lead to some significant discussion. A pandemic simply means widespread infection, large numbers in multiple countries. So in that sense, we're still kind of in a pandemic. But thankfully, in the U.S. at least, the numbers have been significantly down, and more importantly, hospitalizations have been down. I mean, we now are in a great position with the tools to fight this amazingly well. In the beginning, I mean, we all lost friends and relatives from this disease. Now, with vaccination, it cuts down 85 to 90% of those potential mortalities. And even if you're a high-risk person, we now have medicines that can further cut that group down by 90%. The problem is, with all of these big advantages, we've not totally been taking advantage of it. People aren't adequately vaccinated yet, and really people aren't even taking these medicines in some of the high-risk groups. So we want to get that message out. With the Israeli data, we find a survival benefit for people who are over 60 to get that third and even the fourth booster. So we want to make sure that people understand that and don't bypass these ways that we can keep this thing under wraps.
Just this week, I think Pfizer applied to have a booster shot given to some of the younger children.
Yeah, and I think that's going to be important. The problem is the younger kids that are already approved of the vaccine have not really gotten a great uptake. Parents, unfortunately, say, you know what, I'm going to be on the safe side and not give the vaccine to my kids. Unfortunately, the mathematical safe side is resoundingly in favor of giving the vaccine. You're much safer being vaccinated than you are without any protection against this. We don't do a very good job as human beings of comparing two relatively small risks. Thankfully, most kids who get this do fine. But way more kids do fine that are protected than those that are not protected. So that vaccine is going to be helpful in any age group that we've seen so far, and including the elderly who've not, again, taken advantage of their boosters as much as they did the first two, where they were really protected. But unfortunately, like the sands in the hourglass, that protection is waning over time, maybe more than the younger people. And so that's why we've seen more cases and severe cases in those elderly people who were initially vaccinated but have not kept up to date with that protection.
Obviously, what Dr. Fauci says carries a lot of weight because of who he is. And I don't think she said he could clearly answer how long we'd have to be taking these booster shots and vaccinations. Can you weigh in on that?
Well, I think we really don't know. We're in some ways still sort of at the mercy of whatever new variants come on the horizon, because the next variant out there may bear a lot of resistance against our previous vaccines. We just don't know. Thankfully, that really hasn't happened yet. It's happened to a little degree, but people who are up to date on their vaccinations, even those based on the initial virus, still have tremendous protection against hospitalization and death from even these later variants. Although it's chipped away a bit at it, we hope that that will not continue. We just want to stay up to date with what we have right now, because we know it does protect right now.
And I know you said we are not where we were in this pandemic when we were really in the throes of it. We have improved so many as far as how many cases we have of active cases of coronavirus. But would you say that now is the time to be talking about being out of the pandemic when cases are starting just to climb just a little bit?
Yeah, I think we have to be a little bit careful about it because people are already sort of psychologically over this, maybe even more than they need to be. So we just have to be careful. Clearly, the numbers have ticked up in our community. The health department today saw a significant increase in numbers. We've known this for 2 or 3 weeks, those of us on the ground getting phone calls as physicians taking care of people. So the numbers are clearly up compared to what they were 2 or 3 weeks ago. Now, most people won't get ill. Thankfully, hospitalizations have not been ticking up in coordination with that like they have more with the previous variants. We want to keep that the case. We want to make sure that the severe illness as measured by hospitalization, which always has been the most consistent, best way to look at the impact on the severity of the community, we want to make sure that that stays low. And that's really what we should be about.
And at this phase of the pandemic, or being out of the pandemic, how are the patients that you all are seeing now, how are they doing? Are they, because a lot of them have had vaccinations, are they not getting as sick?
Yeah, most people that we see, in fact, probably, as was sort of alleged early in the pandemic and not the case, now it is more the case that more of what we see actually are people who might be admitted for other things that happen to be COVID when you screen them. There's one caveat. There's one very large caveat in all this, and that is that increasingly we see the downstream effects of COVID are just now being understood. We know, for example, that if you're within a couple of months of having COVID and you need a bypass surgery, your death rate from that surgery is significantly higher than if you had not had COVID. So we know that it may increase risks of diabetes, other cardiovascular effects. So increasingly, this virus is just seen as something it's best to avoid altogether, even if you don't get terribly sick when you get it, because some of those downstream effects may not be proportional to how sick you are when you actually have the illness. So for all those things, we need to understand that better, what the longer term problem is, because you increase 5 or 10% the cardiovascular risk of people who get COVID, and that's 60% of America. You're talking about a huge public issue of expenditure and healthcare problems. That's money and effort that could be better spent other places, since we can avoid this altogether.
All right, Dr. Thurighill, thank you so much for being with us today and for updating us on the coronavirus in our area.
Thanks, Stephanie.
All right, now when we come back, fighting evictions just got harder for renters in Tennessee. We'll have a closer look at a controversial new state law. That's next on Informed Sources.